am the director for the Center of Innovation for Patient Care Delivery, which means we have a very strong belief that the frontline healthcare workers really understand the patient, the family, and any gaps in that care. And so we want to elicit and support them in coming up with ideas and taking that from ideation to fruition. Testing for COVID patients. How do you collect specimens without cross-contamination of the actual hospital bag that travels throughout the hospital and then lands in the laboratory? That's one issue. The other issue is there are several steps, if you didn't have this device we created, to be able to clean the outside of the bag, take off your gloves, put on new gloves, especially at a time when a lot of the PPE was in shortage. And so this device really takes a lot of those steps out of the equation. So we are now just testing it through phase 2 of the prototyping, and we're sort of taking all the feedback from the frontline staff and helping inform the newer design for the next prototype. In a period of a month, we have saved over 200 hours of a staff person's time, and which equates to about 5 full-time equivalent staff people. So, and it isn't to cut costs, but rather that if a nurse is taking all this time to just, process a lab specimen, that's taking them away from patient care. And that's what we're hoping to do, is repurpose that. I feel like I'm very innovative. I really like to think a lot out of the box. And it doesn't have to be a device, but, we implemented different care models and things like that. And I think what I knew this about me since I was a student. And I wish I had mentorship at that point, believe it or not, and into my career to sort of, A, give you confidence that you're not crazy, and 2, really how to position yourself or message your things that you want to try. Luckily, I had lots of visionary leaders in my life, but I see others that don't, and allowed me to pilot and test and things like that. So what I wish that was missing in my thing, I had a lot of ideas that actually came to market later on, and I just wish I'd known all that information. And that's what I'm trying to do now, is give that information to and support to the people that are innovating at this point.